My name is Lynette McLaughlin, and I'd like to talk to you today about Illinois Bill SB 1815, otherwise known as the Naloxone Liability Exemptions Bill. This bill was introduced into the Illinois legislature by Senator Chapin Rose. Naloxone is an opioid antagonistic drug. It actually reduces the effect of opioid in the body. It restores the person to a normal level of consciousness, and it restores a person to a normal respiratory pattern. Well, why is that important? I'm going to tell you about that shortly. But first, a little bit more about the bill. Illinois Bill SB 1815 does two things. The first thing it does is it removes liability on a prescribing practitioner who prescribes this naloxone to a patient at risk of an opioid overdose, or a person who themselves is not taking an opioid, but may be in the position to administer naloxone to a person in an overdose. It also amends the Good Samaritan Act. And what that means is any person, be it a trained medical professional or a lay person, can administer naloxone without legal liability. So through a triad, starting with legislative support that removes legal liability from the person administering this medication, additionally, going ahead and making naloxone readily available for the public, and last but not least, increasing public education on the administration of naloxone, we can actually change this opioid overdose from a death situation into a treatable medical emergency. Right now, there is a big stigma attached to opioid overdose. In fact, I'm going to share one statistic with you. 80% of people who are affected by an opioid overdose are actually in the company of family or friends when they overdose. Yet, 80% of people, when they are found as a result of an opioid overdose, are found alone. And that's because of the stigma attached currently with the opioid overdose. So again, if we introduce this bill into the Illinois legislature, we can actually change this from this risk of opioid death into a treatable medical emergency. Some more statistics. 30% of the population experiences today acute or chronic pain, which means that a large amount of individuals are actually taking opioid pain medications. And again, anybody taking an opioid prescription drug or persons that get heroin off the street are at great risk for an opioid overdose. Illinois in the years 2014 to 2015 saw a significant increase in opioid deaths. It went up by 7.6%. Hospital emergency room visits have gone up significantly throughout the country with opioid overdoses. Another benefit actually for the state of Illinois would be that persons that go to the emergency room now are at staggering number for these opioid overdoses, and that is a big drain on our healthcare system fiscally. And again, with naloxone kits are $10 to $15 per kit. So that would produce significant savings to the state of Illinois if we go ahead and make the naloxone readily available. We educate the public about the opioid overdose epidemic and how we can prevent it. And we remove legal liability for persons either prescribing or administering naloxone. So again, I am encouraging the support of this bill to get passed in the Illinois Senate so that we can change opioid overdose from a potential deadly situation to a treatable medical emergency with the administration of the naloxone kit. Naloxone can be given intramuscularly, it can be given intranasally, and this is easily, readily available, affordable, and something that a layperson can be taught. Thank you for your time.